Assalamu alaikum wa rahmatullahi wa barakatuh. We will continue today the lecture of the spleen with Dr. Mohammad Algazar, lecturer of general surgery. The last lecture we take a brief history about the spleen and the anatomy of the spleen and the function of the spleen. Lastly, the trauma of the spleen. We will talk today, inshallah, about the splenomegaly. Splenomegaly is a term which means that the spleen is enlarged. Megaly meaning enlargement, so splenomegaly meaning spleen enlargement. As we said in the last lecture, the spleen extends between the 9th rib to the 11th rib in the left hypochondrium, lays behind the ribs. So enlargement of the spleen to be palpable must be enlarged 3 times more than normal. 3 times more than normal to be palpable below the costal margin. As we said in the last lecture also, the enlargement of the spleen is descend downwards towards the right iliac fossa, as we see in this picture. This is the spleen. This line, blue line, outlines the spleen, which is a huge spleen. Spleen enlarged downwards towards the right iliac fossa. Why? Due to phrenicocholic ligament. Phrenicocholic ligament leads to descent of the spleen towards the right iliac fossa, with some exceptions in 3 situations: when the phrenicocholic ligament is congenitally absent or surgically removed, or when the spleen is heavy, like in the cases of leukemia. Splenomegaly is a sign of a disease. Splenomegaly is a sign of a disease. In fact, multiple diseases can cause splenomegaly. So, splenomegaly is an alarming sign of the presence of a disease which may be catastrophic, like in the cases of leukemia or lymphoma. So, splenomegaly must not be taken lightly. It is a sign of a multiple of diseases, multiple differential diagnoses must be put in our minds to diagnose or to reach the diagnosis of a case of the splenomegaly. Why the spleen is enlarged? We have multiple causes for enlargement of the spleen. First of all, in clinical examination, how to know this is a spleen? As we said in the last lecture, the spleen has a notch. So the splenic notch is a pathognomonic for this is mass. This abdominal mass is a spleen. Move up down with deglutition, mass in the left hypochondrium with notch, and move up down with respiration. Move up down with respiration, and you can't insinuate your hand between the mass and the costal margin. And if you can't get its upper border, you can put your hand between the costal margin and the mass. And if you can't get its upper border of the mass. The mass is not palatable. What's the meaning of palatment? This in clinical examination, the kidney is palatable. So mass in the left hypochondrium with the notch not palatable, move up down with respiration. You can't insinuate your hand between the mass and the costal margin, and if you can't get its upper border. This is a splenic mass. What are the classification of the splenomegaly? Splenomegaly is classified according to Hackett's grading system. The spleen is not palpable, may be enlarged, but not palpable. To be palpable, it must be enlarged 3 times more than normal. The first is palpable on deep inspiration. The second grade is palpable but less than half the way to the umbilicus. The third is reaching the umbilicus but not below it. The fourth grade of the splenomegaly is reaching the umbilicus, below the umbilicus, and this is the huge splenomegaly. Huge splenomegaly reaching the umbilicus. Fifth grade is between the way between the umbilicus and the symphysis pubis. This is the Hackett's grading of the splenomegaly. 0 not palpable, 1 palpable on deep inspiration, 2 palpable but less than half the way to the umbilicus, 3rd not below the umbilicus, 4th blue. The umbilicus fifth halfway to the symphysis pubis. This is Hackett's grading of the splenomegaly. Huge splenomegaly is the spleen which reaching the umbilicus, fourth and fifth grades. Huge splenomegaly is the spleen which is reaching the umbilicus. We will talk about the huge splenomegaly causes. What are the causes of the splenomegaly? As we said, the splenomegaly have a variant of the causes. We have many causes. To remember the causes of the splenomegaly, we use the mnemonic China MS. China MS. China C is for congestive causes of the splenomegaly. By the way, in Egypt, is the most common cause of the splenomegaly is congestive, which is portal hypertension. Portal hypertension mainly is caused by liver cirrhosis. Liver cirrhosis due to hepatitis C or hepatitis B or bilharzia periportal fibrosis causing portal hypertension, and by far it's the most common cause of the portal hypertension worldwide is liver cirrhosis. So yeah, what's the most common cause of the splenomegaly in Egypt is portal hypertension, which is congestive cause. Congestive and maybe congestive heart failure. Congestive heart failure maybe leads to enlargement of the spleen as reflux of the blood from the failed heart to the IVC. The IVC from the IVC from the IVC to the hepatic veins to the portal vein to the splenic vein, and lastly to the spleen, leads to enlargement of the spleen. Splenic vein thrombosis. Splenic artery gives blood to the spleen, and the splenic vein drains the blood. If the drainage is blocked, the blood came to the spleen and not drained due to splenic vein thrombosis. The first cause of the splenomegaly is congestive causes. Portal hypertension is the most common cause of the splenomegaly in Egypt. Worldwide, the most common cause of portal hypertension is liver cirrhosis. So liver cirrhosis is the most common cause of splenomegaly in Egypt. Hemolytic anemias. Hemolytic anemias like thalassemia. Thalassemia, one of the most common causes of the splenomegaly, like thalassemia major, leads to huge splenomegaly. Portal hypertension, huge splenomegaly, and spleen reaching the umbilicus. Hemolytic anemias like thalassemia major, enlargement of the spleen leading to hemolytic anemia. Hemolytic anemia. Infections. China, I for infections. Maybe viral infection, bacterial, parasitic. But by the way, the parasitic infestation in Egypt and Japan, which is bilharziosis, is the most common cause of the splenomegaly in Egypt for many years. For 1,000 years ago, the bilharziosis is the most common cause of the splenomegaly in Egypt. So parasitic infestation is the most common cause of splenomegaly in Egypt, and concomitant virus C infection is the most common causes of splenomegaly in Egypt. But there is a viral infections may cause splenomegaly, like infectious mononucleosis or bacterial infections, TB, and syphilis, sepsis in general may lead to enlargement of the spleen, typhoid, or splenic abscess. So China MS, China C for congestive, which is a common cause of splenomegaly, portal hypertension, which is most commonly caused by liver cirrhosis, congestive heart failure, and rarely splenic vein thrombosis. Hemolytic anemias, thalassemia major. Patients with thalassemia has a huge splenomegaly. What is a huge splenomegaly? Spleen reaching the umbilicus, grade 4 and grade 5 Hackett's classification. Infections, by the way, the parasitic infestation, bilharziosis, is the most common cause of splenomegaly. Bacterial and viral infections, not rare but not common, like infectious mononucleosis, typhoid, syphilis, sepsis, and TB may cause splenomegaly. Neoplastic. As we said in the beginning of the lecture, splenomegaly is a sign, maybe sign of a catastrophic disease. So we must not take the sign lightly, because it may be a sign of leukemia or lymphoma or secondaries malignancy extending or metastasized from another site. So leukemia or lymphoma may cause splenomegaly, and leukemia cause huge splenomegaly, which descend to the left iliac fossa, as we said in the lecture of the anatomy, because it overcomes the phrenicocholic ligament. So leukemia spleen descend to the left iliac fossa, not to the right iliac fossa, due to heavy deposits in the spleen. Huge splenomegaly is caused by leukemia. So we have huge splenomegaly in portal hypertension, in thalassemia major, in bilharziosis, in leukemia and lymphoma. Huge splenomegaly, meaning reaching the umbilicus. A for autoimmune. Autoimmune autoimmune diseases like idiopathic thrombocytopenic purpura, PTK, which is caused by decreased platelets, which is an idiopathic autoimmune disease. Rheumatoid arthritis, we have Steels and Fleetes syndromes. Steels and Fleetes syndromes are rheumatoid arthritis associated with splenomegaly. It's autoimmune. Systemic lupus erythematosus, SLE, systemic lupus leading to enlargement of the spleen. Fleetes syndrome and Steels syndrome are the rheumatoid arthritis associated with splenomegaly, and Steel's disease associated with lymphadenopathy also. Metabolic, MS, China, MSM, metabolic amyloidosis and porphyria. Amyloid material is deposited in the spleen, leading to enlargement of the spleen, while the porphyria is an important error of hemoglobin synthesis. As we said in the last lecture, the one of the functions of the spleen is recycling of the iron and the destruction of the old RBCs. So important errors of the hemoglobin metabolism leading to enlargement of the spleen. Storage diseases like Gaucher disease, glucocerebrosis. Glucocerebrosis is the deposition of the fatty acids in the spleen, leading to huge splenomegaly. So we have splenomegaly causes and huge splenomegaly causes. The most important in Egypt is the bilharzial splenomegaly, portal hypertension, leading to huge splenomegaly, grade 4 and 5 Hackett's, which reaching the umbilicus. Hemolytic anemia, patient with thalassemia, leukemia, which descend to the left iliac fossa, lymphoma, which leads to enlargement of the spleen, huge enlargement of the spleen. Autoimmune like ITB, rheumatoid arthritis, systemic lupus, and Gaucher disease. Storage diseases like Gaucher disease. Again, we must know the causes of the splenomegaly. We must not forget these causes. This mnemonic will help you to revise the causes of the splenomegaly and to remember them. China, MS. China, C, congestive portal hypertension. H is for hemolytic anemias. I for infections. N for neoplastic leukemia, lymphoma, secondaries. A, autoimmune. M, metabolic amyloidosis, porphyria, and storage disease like Gaucher disease. We will take the hemolytic causes of the splenomegaly, or hemolytic hematological diseases of the splenomegaly today. Discussion, we will start with spherocytosis. Spherocytosis, one of the hereditary diseases which doesn't cause the enlargement of the spleen but leads to destruction of the RBCs on the spleen. Doesn't lead to massive enlargement of the spleen. The spleen may be small, not reaching more than 3 times more than a normal, but the spleen have overfunction in the hereditary spherocytosis. So what's the hereditary spherocytosis? And the main treatment of hereditary spherocytosis is surgery, which give a very good results. more than medical treatment. So what's the hereditary spherocytosis? Hereditary spherocytosis is an autosomal dominant disease. Autosomal dominant disease, and this is a problem for the offsprings because it's transmitted to sons and to the sons. Autosomal dominant disease. What's the problem in the spherocytosis? Absent of band 3-1 and ankyrin and spectrine in the cell wall of the RBCs. As we know, the RBCs is discoid. This is normal RBCs. Normal RBCs is discoid. To pass through the capillary is easy, so it's discoid. The absence of band 3-1 and ankyrin and the spectrine in the wall of the RBCs is the absence of BAS, leading to formation of the weakness of the cytoskeleton of the wall of the RBCs, and the RBCs become spherical in shape. This is so it's called spherocytes. Hereditary because it's autosomal dominant. Spherocytes because become like a sphere, so it's become abnormal. As we see here, the discoid RBCs say to the spherocyte, you are abnormal, you will die, outcasted, stuck in the spleen. The function of the spleen is to create RBCs and to get rid of all non-functioning RBCs. So, in the case of spherocytosis, the patient has an RBCs which is a spherocyte-like. They are stuck in the spleen, leading to enlargement of the spleen, splenomegaly. We see spleen here. My weight gain is bind dilatation, enlarged into monster spleen, become monster, and they can't leave the spleen and may be engulfed by the splenic macrophages and destruction of the RBCs, leading to anemia. So the patient is complaining from anemia, and some RBCs can't reach the spleen, non-deformable spherocytes, so they are destructed in the peripheral circulation, leading to gallstones, jaundice, splenomegaly, destruction of the RBCs, extravascular hemolysis, leading to formation of gallstones, and the hemolysis of the RBCs, which one step of the bilirubin metabolism, leading to jaundice and splenomegaly. So the patient have splenomegaly, jaundice, gallstones, splenomegaly, jaundice, and the gallstones, and the blood film containing the peripheral smears containing spherocytes. Blood picture containing spherocytes with hyperbilirubinemia. One of the tests of the spherocytosis is the osmotic fragility test. We see here this spherocytes. Water can kill. Stay away from hypotonic solutions. Spherocytes, hypotonic solutions of similar concentration so the osmotic fragility test kill the spherocytes, increase the osmotic fragility, begins at 0.7 and completes at 0.4. The spherocytes are disrupted at 0.4 percentages. Hypotonic solutions will lead to rupture of the RBCs. Spherocytes is lysed and engulfed at the hypotonic solutions. This is the osmotic fragility test. Again, hereditary spherocytosis is an autosomal dominant disease. What's the problem? We have a problem in the cell wall of the RBCs, in the absent BAS, band 3-1, ankyrin and spectrin, leading to formation of spherocyte RBCs. The normal RBCs is discoid, not spherocyte. So these spherocytes will be destructed by the spleen. Destruction of the spherocytes leads to anemia, destruction of the RBCs, anemia, and increase hemolysis of the RBCs, hemolysis leading to jaundice and splenomegaly, because the spleen become enlarged monster, and spleen become a monster, and the hemolysis of the RBCs with extravascular hemolysis. So the patient is complaining of splenomegaly, monster spleen, which eat more RBCs, jaundice due to hemolysis, and gallstones due to hemolysis, anemia due to destruction of the RBCs with extravascular hemolysis. The patient of the spherocytosis is diagnosed by the blood film. The blood film show spherocytes, not a discoid RBCs, but the sure diagnosis is osmotic fragility test. Due to defect in the wall of the RBCs can't withstand the hypotonic solutions. Hypotonic solutions, the RBCs, spherocytes doesn't withstand the hypotonic solutions. So if we put a spherocyte and the discoid RBCs, normal discoid RBCs, in two hypotonic solutions, the spherocytes will rupture, can't withstand the hypotonic solutions, while the discoid RBCs can withstand the hypotonic solutions. This is called osmotic fragility test. Another way to detect the lifespan of the RBCs, we labeled it with chromium 51 and detect it by radioactive materials scanning by the gamma camera. We can inject the RBCs, which is labeled with chromium and is destructed in the spleen in a short time. We do ultrasound examination for the patient with spherocytosis to detect the splenomegaly and to detect the gallstones, which is form of hemolysis. What's the treatment of the spherocytosis? The treatment of the spherocytosis may be supportive treatment, blood transfusion to avoid anemia, and corticosteroid if the patient is not responding to corticosteroids. Is splenectomy is a solution of this patient because it destructs the RBCs. So we remove this monster which destructs the RBCs, and the patient get well after splenectomy. If there is gallstones, we remove the gallbladder, cholecystectomy during or after splenectomy to avoid complications of the gallstones. So summarize: hereditary spherocytosis, autosomal dominant disease, defect in the wall of the spherocytes. The spherocytes is destructed in the spleen, leading to splenomegaly, anemia, jaundice due to extravascular hemolysis and hemolysis of the RBCs, jaundice and anemia, the splenomegaly. Osmotic fragility test, destruction of the RBCs at hypotonic solutions. Ultrasound is done to detect the splenomegaly and the gallstones. The treatment is steroid. If not responding to steroids, we remove the spleen. Splenectomy if there is gallstones.